I'm Mr. Anil Joshi. I'm one of the consultants in ear, nose and throat with subspecialization in facial plastic surgery. I work here at BMI Blackheath Hospital in London. A tonsillectomy is surgical removal of the tonsillar tissue. Tonsils are two almond-shaped structures within your throat, and they form a part of your lymphatic chain. They essentially help your body to ward off any bacterial or any kind of infection and help your immune system. However, these are only useful in the first couple of years of your life. Surgery for these is usually a day case procedure, and which means that you come in the hospital in the morning or in the afternoon and go home the same day. The procedure would be performed under general anesthesia, which means that you will be put to sleep throughout the procedure. If someone is getting a very regular attacks of tonsillitis, or we call it as recurrent attacks of tonsillitis, or if they've got something called as a quinsy, which is having an abscess at the back of your tonsil, or people with very large tonsils which can obstruct their breathing, and also in conditions which are called as the obstructive sleep apnea. These are also more common in children who do have large adenoids and the tonsils, which can be combined together and operated as what we call as adenotonsillectomy. Occasionally, we may have to remove the tonsils if we suspect anything sinister as well. That will be sent off for histological analysis. The operation is performed through the mouth itself, which means that we do not perform any external incisions outside, and it usually takes around 30 to 45 minutes. There are various methods with which tonsils can be removed. The commonest that we use is something called as the cold steel method, along with diathermy, which is electrical current, which we use to stop some of the bleeding and also try to dissect the tissues out in a nice way, which will prevent as much bleeding as possible. And there are other methods which are called as the coblation tonsillectomy as well, which we can discuss with each individual patient and tailor make it according to their situations. These are the main ways that we do. And after the surgery, you will be brought back to the wards. And once you are awake and feeling just a bit well within yourself, the nurses will initiate you to start eating and drinking. And once you are well after that, you should be able to go home, which is usually around 4 to 6 hours post-surgery. But all of these will be dictated according to the clinical methods or situations on the day of the procedure. The benefits will obviously depend on the kind of the reasons that we do for the surgery. So if it is for regular or recurrent episodes of tonsillitis, this will prevent future tonsillitis. Of course, one may still get sore throats. However, these will be far and few in between, and they may usually be because of pharyngitis. That's one of the benefits. And again, if someone, or a child or even an adult, are getting obstructive sleep apnea, and in such individuals, it may benefit to an extent. Of course, it also can be dictated by other sleep studies and so on and so forth. And lastly, if we are doing it for any diagnostic purposes, we can get the answers from histological analysis, and then based on that, we can take the management options forwards. One may feel a bit of soreness in their throat after even at least for a week to 10 days, or sometimes even to 2 weeks. You may feel a bit rough in the initial few days and difficulty to eat, but the more you start eating and drinking, the better you're going to feel. The muscles which are just behind your tonsillar pillars, they get supple the more you eat and drink. Conversely, even if you are having the pain and if you don't eat, the muscles can go tight, and that can cause more pain. However, these pains can be amenable with regular analgesia, which are ibuprofen and paracetamol. And usually what we say is by the end of 6th or 7th day, the pain can get a little bit worse before it gets better. However, this is a completely healing process. One can up the painkillers a little bit, and that should take the edge off. I would say you can take time off from work for at least a week, if not 2. And we are happy to write a sick note for you, which you can give it to your workplace. And again, it's the same thing for children, and they could take time off from school for a week or 2. And based on, again, their clinical situation, we can dictate how they can go back to work or school.